My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association. We are located in New Mexico, Colorado, and Georgia, and we have a board of directors from across the nation, and we have community advisory council members from across the nation, all, of course, including New Mexico residents and leaders. We serve as a nonprofit training and technical assistance center. Our primary mission is to address the disparities pertaining to behavioral health that impact Latinos and their well-being. Our focus is around policy advocacy, education, and information. We also focus on behavioral health workforce development, and our expertise is in training and technical assistance to help organizations, both government, public, and private, to help serve Latino populations who need behavioral health services. We also run a prevention program that's actually here in New Mexico. Lastly, we serve as an organization who helps ensure that Latino students get scholarship assistance from our organization for those Latino students who are attending college full-time, pursuing a degree in behavioral health. So that's the organization in a nutshell. We've been in existence since 2001. We were formed as a result of a recommendation presented to the President Clinton administration called the National Hispanic Mental Health Congress. And one of the recommendations was, at the time, was to form a National Latino Behavioral Association. And thus was the beginning of the organization led by Josie T. Romero and several other key board members. I've been with the organization as a board member starting in 2008, became its operations manager in 2011, and have been with the organization ever since. And I currently now serve as its executive director. And we serve in such a fashion that most of our work is done virtually. But now, since COVID has been here, we do almost all of our work virtually. But prior to that, we did a combination of virtual and in-person work. So that's us in a nutshell. Well, the National Latino Behavioral Health Association has had a long-standing relationship with the Behavioral Health Services Division with the state of New Mexico at the Human Services Department. I actually was a former state employee, so I had worked for a period of time with the New Mexico Behavioral Health Purchasing Collaborative and served as an executive administrator for that work. And my office was at BHSD. So I've known the staff there over the years, and I'm retired from public service. And our relationship really stems from the work of the division, and my entire career has been related to behavioral health. I have interacted with the state of New Mexico and the Behavioral Health Authority for both adults and children for most of my career. I was a former community mental health center director in Colfax County and Santa Fe County, gosh, dating back to the 80s and the 90s. So I've been in the field my entire career. So I have a longstanding relationship with the state and the agencies responsible for contracting and providing for the delivery of behavioral services for adults and children. The relationship we have recently with the Office of Peer Engagement and Recovery has been focused really on something very unique, and that is to continue to bring the voice of individuals who are in recovery to the forefront so that they can help speak to the issues that are significant to peers given their circumstances. And our relationship with OPRI came as a result of a conversation we had with the staff about how do we continue to provide community information, community education about Latinos peers that are in recovery. It's a unique voice because it's very telling. You know, in the state of New Mexico, almost 48% of the state's population are Latinos. But we also know that Latinos disproportionately represent individuals who are active with drug addictions and substance abuse. But it also represents many others who are in recovery. And so we help to articulate that voice. And so we've had a program that we've managed called Tenemos Voz, which is Spanish for English, meaning we have a voice. And it's a venue, a vehicle, platform for Latinos to be able to talk about recovery so that they can help inform their family members, the community at large, about the significant barriers, the challenges, the issues, the hopes, the aspirations for improving their lifestyles and changing their lifestyles, making different choices, and being able to live a life that's free of addiction and substance abuse. So our relationship with OPRI evolved into their hosting and supporting something we call Platicas, which is a live Facebook event where we invite Latinos in recovery and people associated with them, family members, providers, experts in the field, to talk about Latinos that are in recovery, what that looks like, what the resources are, and more importantly is what can they do to actually reach out and seek information about treatment and about support and how it is that they can help encourage others, in particular Latinos, to really start making changes that help them improve their life circumstance and reduce the deaths that people are experiencing, to reduce the length of their addiction period, and to help reduce the trauma and the difficulties that it comes with addictions, the impact on the family and their own lives. So our partnership has been led, of course, between my office here at NALBA and Milicia Montaño and Nathan Lawson, who have been just phenomenal. We have this monthly Platica where they also participate as hosts. So we share in tandem in that role. So that's a little bit about the partnership we have with OPRI, but we also do some other things. We support them with ethics training for peers. And we've also provided a variety of other trainings, by the way, for peers, including cultural competency. We also have something called Promotores de Bienestar, which is a whole health, whole person curriculum to help train individuals in the community about how do they get informed about mental health, substance use, opioids, and other issues that affect their lives. We're very active with a program called Connecting Our Voices, which is a prevention program for kids between 11 and 14. We do this program in northern Santa Fe County and southern Roraima County. Its primary focus is to reduce the onset of substance use by young children. And one would think, well, gosh, why start so early? Well, the reason you start so early is because kids are already experimenting even before they're teenagers. And it's going to have a major effect on brain development. So we understand and realize the earlier you help provide information and education for children and their parents, helps them to mitigate the risks that our kids are exposed to today, right? And we also know this, that by the age of 14, 50% of mental illness is already going to develop in youth of that age. So you could see that the first quarter of the human life is affected by the things that affect the brain development, the person's well-being. So it's important that we prevent illnesses from beginning to negatively affect the children and young children and certainly young adults. So that prevention program has been important for us. We have just finished our first cohort group and we'll be starting our next cohort group up in that area. And what's important about that is that, when you prevent people from beginning to engage in substance abuse earlier, it's going to actually have a more positive impact on their ability to be productive, contributing to society, reducing the number of dramatic and traumatic circumstances, events that they get involved with, reduces crises, and more importantly, it helps them to be, engaged in their families, in their futures, so that they can be productive citizens. Well, Hispanic Heritage Month is really important, right? We've known that advancing social justice and civil rights is important to Latinos in the United States, given that we've had a very complex history in the United States. Most of us, if not many of us, were actually part of Mexico, and prior to that, part of Spain, and then part of that was, for those of us with indigenous ancestry, we've been in this area for a very long time. So Hispanic Heritage Month is a way of recognizing that unique ethnic group, right? Because it represents the diversity that comes with the Hispanic population, right? There's 20 plus nationalities of individuals representing Latin America, Central America, South America, and now certainly all of North America, including the Antilles, who have Hispanic bloodlines, but also have indigenous bloodlines. Because of that this variety and diversity is so huge that most of us take great pride in our heritage and our culture, and Hispanic Heritage Month is a way to acknowledge that. But our focus, of course, is to understand that the protective factors, the assets, the contributions that Latinos make are very powerful. not only for our own well-being, our way of protecting our families and ensuring that, we are able to advance the work that we do because we're essential workers in this country. We're professional workers in this country. We ourselves contribute to the economic and political success of our country. We all have long histories as veterans or people in the military, National Guard, and there are lots of folks who have been in the public service as well as in private employment. So we are a big contributor to this nation's success, and we want to take that 1 month to, speak to our successes and our contributions. But we do that in such a way that it's not intended to try to focus on the conflicts that have come from the historical past. Culture is what the people do in their lives and how they do it. It's the way people value and believe what's important to them. It's the things that they do to give that meaning to life, right? Because it's one thing to say you're from a racial or ethnic group, but the truth of it is it's your culture that really helps to identify how you live your life. And Hispanic Heritage Month is a very powerful way to illustrate that. And we'd like to partner up with groups in that month to pay tribute to the Hispanic communities, not just in New Mexico, but across the United States and across the globe. Spanish is spoken by such a large number of people across the entire globe that there's great value in being able to preserve, promote, and educate in that language. And for those who are bilingual, it's a powerful asset. We live in a society and in a global community where it's important to communicate with people in their language. So in New Mexico, it's very relevant, right? Because we make up the highest percentage of any state with Hispanic population, and followed by, of course, California and Texas. So NALBA is an example of how you want to have us advocate, speak for, and talk about what is needed to help improve the well-being of Latinos in our state, our communities, and in our nation. Two best ways to get a hold of us are absolutely through our website. It's www.nalba.org. NALBA is the National Latino Behavioral Health Association, so that's the acronym. And then Facebook. We're very active in social media because Latinos use social media a lot. And so just go to the NALBA Facebook page and you can get in contact with us either of those two which ways. And we encourage people to actually sign up for something called our Juntos Network. It's for free. It takes you less than a minute to sign up. You get to get all this information I just talked about free because we're funded by public resources. And so that means that everything that we do, the services we provide, the assistance we offer, all of that is available for people who can go to our website to learn about those programs and services and then participate in them. Because, gosh, when they're for free, all that's needed is to connect the dots, right? So we're here with information. There's community members who want information, and the whole idea is how do we bring this together? And for us, it's called the Juntos Network. And again, it's free of charge. It's our communication hub. It's how we talk to the world about what we do, how we do it. Encourage you to be part of that, because part of that is the collective wealth of information that we have and the collective wealth of people who bring their own life expertise to bear can connect. So yeah, go to those two places. That's the best way to get a hold of us.